The Liqour Owners Association says reinstating the alcohol ban comes as a big surprise for the industry, which has not been consulted, but has been consulting government on this decision in the past. Now, he fears that the ban will come back to bite the government. We are now joined by Sibani Mngadi, the chairperson of the South African Liquor Brand Owners Association, to discuss this matter. Sibani, good evening, and thank you for your time tonight. Were you consulted at all before this decision was made, and do you feel you should have been consulted?
Good evening, Dabo. Secondly, we were not consulted, and it's very disturbing because I think at level 5 and level 4, there was really a genuine consultation with all of business, so all sectors that were affected. You remember the time we were not selling, but at least there was clear communication as to the reasoning behind that and how the risk-adjusted strategy was going to play out, and when were the opportunities for alcohol to sell, even when we were about to open it on the 1st of June for level 3 restriction. Clear consideration and discussion with government, with us giving reassurance on safe operations from production out to retail, as to how we're going to make sure that at least in store we make sure people are not exposed, both our employees as well as shoppers, from any possibility of infection that they have.
How are you going to assist government, if you were consulted at all? Because it looks like the government concern here is around the sensible consumption of alcohol. Yes, tavern owners could have abided by the rules as set out and the commitments that you made prior to the opening up of alcohol sale. But how were you going to assist government if you were consulted with the issue of sensible consumption of alcohol?
Okay. Yeah, if I follow, maybe to take your first earlier question to the caller, that the issue around non-medical intervention, so use of masks and so on, what we had asked for was people to have an opportunity to purchase for home consumption. From that perspective, in a home environment, then those issues kind of fall off. Now, the issue then that arose was these things about people gathering in certain, gathering together in private homes and then traveling and then accidents and so on. So from that perspective, I think had we been consulted, we were going to support the curfew, which probably solved that problem to a certain extent. People tend to party more into the night, and that curfew can cut that off. But also, we had already written to government and the presidency in particular, requesting an opportunity to make preventions on what we think can be done to reduce alcohol harm. And that includes even financial commitment that we are prepared to do to address the issue, because these issues are long-standing. They are not due to coronavirus, and we have commitments to make sure that they are addressed. So for us, for instance, in drinking and driving, we are thinking that the issue is very much around enforcement and how do we support that enforcement and processing of blood for possible successful prosecution.
And looking at the data that was used, according to the Department of Health, to come to this decision to re-ban the sale of alcohol, it's a 2018 report on gender-based violence. 83.6% of households reporting violence at home, alcohol intoxication was involved. That's a big concern. How would you have helped government in that intervention of what's happening in the household of those who consume your products?
Yeah, even ahead of the opening on the 1st of June, we had already started a campaign where we were allowing, we had a partnership with Healthline, where we were giving opportunity for people who are feeling the threat of domestic violence or gender-based violence to be able to call or send SMS to a particular number, and now it's into a referral system where they indicate danger to you. It takes you direct into a police station kind of SAPS connection. If you have much more long-term attention social worker or restraining order, then it allows you to access those services of social work in that bit. So that we had already put in place, and we wanted to then make sure that we work together to scale those things up and make sure that we have enough social work to attend to that. And it's something that we are still putting on the table as an industry, even despite all the circumstances we are in, and it's something we would like to implement further together with government.
Yeah, but it seems with all those commitments which you are saying you've made ahead of the reopening of the supply chain, government still feels that alcohol is related to the high occupancy rate that they are seeing in our hospitals. In fact, they're saying 60 to 70% reduction in hospitals is what they saw when there was the lockdown in place. And after opening, 80% increase in trauma cases in Gauteng alone. 5 hospitals in the Western Cape reporting that 90 people were being admitted each day in their hospital per day with cases that have got to do with alcohol consumption. And overall, when you look at those numbers being given to you, does it justify the ban?
Yeah, I think we need to look at it this way. There is a majority of South Africans, in fact, many of them not drink necessarily, 60% so, and those who drink, which is other. And among those who drink, it's a very small number of people who are drinking excessively. So data that you are talking about, what we wanted to do as an industry is to better understand it. You can't just say it's all alcohol cases. So we need to segment and say maybe drinking and driving, if it contributes 30%, therefore it becomes a priority because of that, or interpersonal violence. How do we deal with it? How do we improve? Is it much more based at drinking sites? And how do we deal with that? I think the problem of violence in South Africa is much more complex than just assigning it to one, two. We need to understand the totality of it. If we look at, for instance, a number of cases on gender-based violence, many of them, they seem to be, at least the prominent ones, there seem to be a pattern of premeditated planning that comes with it. And whether then alcohol played a factor, it's something that we need to analyze. But I'm not saying that alcohol doesn't. Indeed, intoxication does lead to inappropriate behavior. But it's something that we need to sit together with government, with civil society, and discuss and understand what drives it, and then come up with intervention. It's too big a problem to assign it one factor as a driver.
Sibani Mngadi, I appreciate your time. Thanks for joining us tonight.